This is a presentation from Tayside Children and Young People's Occupational Therapy Service. We're here to tell you a bit more about us, what we do and why we do it. What does occupational therapy mean? Occupation is a fancy word for the activities you want to do, need to do and are expected to do on a daily basis. Some of these pictures here highlight some examples of children's occupations, such as using a pencil, using cutlery, tying your shoelaces or riding a bike. Why are occupations important to us? So think about some occupations that you engage in that are important to you. So it may be things like skiing, running, baking. And when you're doing these occupations, you feel happy and energised, which is great for your health and well-being. However, think about if you couldn't do these occupations that you need to do or want to do and how that would make you feel. We need a healthy balance of work, rest, play and sleep in order to function and live our lives to the fullest. As occupational therapists, we ask your child what matters to them and we want to help them and you achieve the goals that they desire. So here are some of the ways that occupational therapists think. Occupation is at the core of all that we do, and we understand the importance of doing and how this impacts on your health and well-being. We aim to put the child and the family at the centre of everything that we do, which links in with our holistic thinking. We tend to look at the whole picture rather than individual parts to support the child and the family as well. We're one of the few professions that have both mental health and physical disability training, and we work with a lot of different variety of settings. This short video clip is a story about Alistair, which sums up nicely the impact that occupational therapy can have and showcases the importance of meaningful occupation. This video can be found on YouTube. We aim to support your child to participate in everyday occupations, to help them lead a full and happy life, to reach their goals, and to learn the skills that they need. We do this by thinking about the person, the occupation, and the environment. If these three things are not working together, then it can be really challenging for your child to take part in what they need and want to do. We also aim to help you and others around you to make changes to improve your child's input. When we think about occupation, we think about self-care, which is learning to wash, dress, eat, and toilet independently. Play and leisure is a main occupation for children, and it's through play that children learn to practice new skills, to make friends, and to find a sense of self. And participation in education is a key occupation for children and young people. We look at these through lots of different environments, whether it's at home, whether it's at school, or whether it's outside in the play area. Ready to Act is a transformational plan for children and young people, their parents, carers and families who require support from allied health professionals. We look at this as a tiered approach with universal, targeted and specialist. Our universal services are for all children and young people, and we focus on a preventative approach to try and promote well-being for children and young people. Our targeted services are for children and young people, their families and carers who are more likely to be identified as having some well-being needs. And our specialist input, this level is for children and young people whose well-being needs cannot be fully met through the universal or targeted provision. This would usually involve episodes of direct or indirect intervention, and this would always be alongside parents, carers and education staff where possible. So you might be thinking, how can occupational therapy help the child that I know? This visual here shows you the stages of looking to support from occupational therapy. First and foremost, we would be suggesting that you access our website, which has lots of universal advice, it has video links, we have information about training, lots of strategies and access to support. Following this, there may be an opportunity to do some universal work with the whole class, whether it's giving some universal strategies or universal resources. It may be that you have a look at some ABLE plans and think about strategies that have been highlighted there. If you're unsure about this, you can get in touch with your school staff. If you're feeling that you need a bit more specific advice and you'd like to speak to an occupational therapist, please feel free to contact our departments. Our numbers will be later on in the presentation. And if you feel you've tried lots of things and you feel the child is still struggling to participate in their occupations, you can complete the request for assistance form, which can be found on our website. We'll now go on to talk a bit about the occupational therapy input and what this would look like for you and your child. So where do we see children? A child may be assessed in clinic, at home or at school, or even a combination of all of these. Occupational therapists carry out several assessments, one being a standardised one. This looks at a detailed breakdown of your child's skills and comparing them to what would be expected of that age. We do some school-based assessments, so we would be looking at the child within their school environment. This may be more observational during class, lunchtime, playtime. And we also look at more functional assessments, looking specifically at the area of difficulty. The occupational therapist will make a decision on what type of assessment to do depending on the information they have as well. Each child is individual, so some may not require intervention after various assessments, and for those that do, this will not look the same for everybody. Each family and child has a different capacity to work with their child, and different children may be more or less motivated than others. Occupational therapists may suggest a block of intervention sessions to work on specific skills, and this may be carried out at home, school, or within the clinic setting. For the most progress to be made, lots of these skills are best worked on within the home and the school environment as well. It's often best if occupational therapy staff can model these techniques to practice with parents, carers, and education staff for these to be continued on with the child. The occupational therapist will work with the child and family to set occupation-focused goals after assessment. The occupational therapist may use a pictorial tool, as you can see here, or a tool such as the child occupational self-assessment, and this will support the child to think about what matters most to them. These goals should be reviewed as the intervention progresses, and at the end of this block we will identify what next steps or further practice the child needs and who's the best person to continue this on with the child. Within occupational therapy, it's really important that we work with those that's as closest to the child. Now that may be home, it may be school, or it may be the wider community. Our aim is to pass on the skills and knowledge to the family, to education, to be able to empower that child to engage in those tasks that they're finding difficult. It's often better for children to have that input integrated within their day-to-day life with support of those who are around them daily and who they are most comfortable with. Within occupational therapy, there are several resources and programs that we can offer to parents and education staff to support their child's skills. One of them being Seaside Adventure and Jungle Journey, which is a nursery and early primary stage program that looks at your fine and gross motor skills. This can be done in PE, and it's a very fun way of looking at the development of your child's motor skills. Little Scribblers is a pre-writing program to help children develop the necessary skills required to use and hold a pencil. This program can be done in small groups or as a whole class. Occupational therapy have been involved in the past to run these sessions alongside school staff and parents, and schools can use these activities that are within the program to help promote early writing skills for children. We also provide training on our sensory processing difficulties and thinking about the ways that this can affect your child's ability to participate in their daily occupations. This training is available for parents and professionals. Have a look on our website and our Facebook page for how to book onto these trainings and the upcoming dates. We have recently joined the Advice Line in conjunction with our physiotherapy and speech and language therapy colleagues. The Advice Line is open to parents, carers and professionals to discuss any concerns that they may have about a child. The Advice Line runs on a Tuesday and a Thursday. There's lots of other ways you can access our service. First and foremost, our website, which has up-to-date links, strategies and resources. You can email us or find us on Facebook and Twitter, where we will share lots of activities and strategies to support your child. Here are also the numbers of each of the local departments if you feel you need to get in contact with an occupational therapist. We also have just set up our YouTube page, which you can search for by looking NHS Tayside Children and Young People's Occupational Therapy Service.